Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Are there any dangers of taking Repatha? One serious danger of taking Repatha, evolocumab, is a possibly life-threatening allergic reaction to the active ingredient. Also tell your doctor if you are allergic to rubber or latex. Other dangers of taking Repatha, which could be serious in some people, include high blood sugar levels, diabetes, respiratory tract infections, urinary tract infections, UTI, high blood pressure, and influenza, flu. Do not use Repatha if you or your child are allergic to evolocumab or any of the inactive ingredients in the injection. The needle cover of the single-dose prefilled syringe and prefilled autoinjector contain dry natural rubber, a derivative of latex, which may cause allergic reactions in sensitive people. You can find a list of inactive ingredients in the Repatha Patient Information, or you can ask your pharmacist for a copy. What if I have an allergic reaction to Repatha? Stop taking Repatha, evolocumab, if you have an allergic reaction. Call your healthcare provider or seek emergency medical help right away. In the US, call 911, if you or your child have any of these symptoms: trouble breathing or swallowing, raised bumps, hives, rash, itching, swelling of the face, lips, tongue, throat or arms, angioedema, any swelling under the skin. Tell your doctor if you or your child are pregnant, plan to become pregnant, or become pregnant while taking this medicine. It is not known if Repatha will harm an unborn baby. Also tell your doctor if you or your child are breastfeeding or plan to breastfeed. Greater sensitivity in older patients may occur, but clinical experience has not identified differences between the elderly and younger patients. What are the most common side effects with Repatha? Most people tolerate Repatha well. Side effects that caused people to stop treatment occurred in 2.2% of Repatha-treated patients and 1% of placebo-treated patients. Myalgia, muscle pain, was the most common side effect that led people to stop treatment, 0.3% taking Repatha treatment and 0% taking placebo. The most common side effects of Repatha include symptoms of the common cold, like a runny nose or sore throat, nasopharyngitis, flu or flu-like symptoms, upper respiratory tract, lung infections, back pain, high blood sugar levels, diabetes, redness, pain, or bruising at the injection site. To see a detailed list of Repatha side effects, visit here. Be sure to tell your doctor about all of the medications you use, including prescription and over-the-counter, OTC, medicines, vitamins, and herbal products. Related questions: PCSK versus Repatha. What's the difference? What is the difference between Leqvio and Repatha? What is the best time of day to take Repatha? Does Repatha cause diabetes? In the cardiovascular outcomes trials, diabetes mellitus was reported as a side effect in 8.8% of those taking Repatha compared to 8.2% on those receiving placebo. In 16,676 patients without diabetes mellitus at the start of the study, 8.1% of patients, 1,351, treated with Repatha developed new-onset diabetes mellitus compared with 7.7% of patients, 1,284, who received placebo. Why is Repatha prescribed? Repatha is a medicine in a class called PCSK inhibitors. Repatha injection is used in adults with cardiovascular, heart, disease to reduce the risk of heart attack, stroke, and certain types of heart surgery, coronary revascularization. With a cholesterol-lowering diet alone or with diet and other cholesterol-lowering therapies in adults to treat high blood cholesterol levels known as primary hyperlipidemia, including a type of high cholesterol called heterozygous familial hypercholesterolemia, HFH. To reduce low-density lipoprotein, LDL-C, also known as bad cholesterol. In addition to diet and other LDL-lowering therapies in children 10 years and older with HFH, to reduce LDL-C. In addition to other LDL-lowering therapies in adults and children 10 years of age and older with homozygous familial hypercholesterolemia, HoFH, to reduce LDL-C. It is not known if Repatha is safe and effective in children with HeFH or HoFH who are younger than 10 years of age or in children with other types of hyperlipidemia. Learn more, PCSK9 inhibitors for cholesterol treatment. This is not a complete list of side effects with Repatha. Call your doctor for advice about any side effects that occur with Repatha, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.